I want to squash all the information out there that it's a hoax in terms of it doesn't exist. It's out there. It's out there. I've treated patients with it. I've put patients on ventilators, and I've seen patients die. I've had to call family members on the line to tell, you know what, your mother, your brother, your daughter have died in the hospital. Because remember, a lot of these hospitals are shutting down and they're not letting people come in from the outside. So saying it's a hoax from that perspective is an affront and disrespectful to, I think, not only the families who have lost ones, and not even the frontline workers who are sacrificing their time and their lives to do it, but the people who have lost their lives fighting it over time. Now, kind of touching on the reason why I think it's different is because I said before, it depends where you are. If you're in New York, you're in New Orleans, you're in Seattle, Cali, a lot of the coastal big cities, they're suffering from this pandemic, right? They're truly suffering. If you're in a place where people in the middle of Kansas or Idaho or something like that, big shout out to Kansas, Idaho people out there, if you're there. If you're out there and you're not experiencing it like that, you don't know anybody who's gotten it, you don't know anybody who's died, then it's not a big deal to you, right? I think it's all about fear and how we perceive it. If you're more fearful about losing your job, not paying your bills, not supporting your family, not putting food on the table, and you're not getting the virus or no one around you has gotten the virus, then that initial fear supersedes the fear of dying or contracting the virus and sending it to somebody else, transmitting it to somebody else, right? And I think it also comes down to a lot of people are saying they don't want the government to be able to dictate what they do on a day-to-day basis, which is understandable, especially if you have to put food on the table for your family and no one around you's at risk or you feel you're not at risk. So I think it comes down to thinking individually or having individual freedom versus having a public obligation, right? Thinking for you individually versus thinking of the collective. You are going to come before anybody else. But if any time your risk impinges on the freedom and the health of everyone else, I think that's where it should stop, right? That's where it really needs to end. And I think we have to continue to thinking like that, especially if you're in an area where there are tons of infections, right? So I'm still leaving this open. If anybody wants to come on and chat with me, I'm open to it. Please have no problem with clicking on the adding to the conversation. I'll bring you on. We can chat right now. Otherwise, I want you guys to continue to remember to hit the @STOOP55 link right there to talk about and to donate, actually, to donate for masks and gowns. We made it over $1,000, but we're still going. We're still continuing to raise money. On Saturday, actually, I'll be with DJ Mose, DJ space MOS on Instagram. He's doing a fundraiser where he'll be going on playing music, getting more money, getting more donations to help people with gowns and masks. And we'll take some time to, he'll take some time to ask me some questions, which should be really fun and kind of broaden our audience a little bit more. So please feel free to add more questions there if you guys want. That was really my sound off for what was going on. A little more updates in terms of what's happening. Right now, we're still working on treatments. There's a study coming out with remdesivir that you guys might have seen. We don't know if it works for sure. Right now, it's okay, but the data is still pretty shaky. So a lot of these treatments are taking a lot of time to actually go to figure out the safety of the people, figure out the safety within the community, all right? So they experiment on patients with the disease and see if it's actually working. And right now it's kind of on the cusp, to be honest. Will we find a treatment? I'm not sure. It's gonna take some time, to be honest. A vaccine usually takes anywhere between months to years to develop. So getting something in place before the second wave, I don't think is realistic. I think what's going to happen is that over time, as states release the quarantine, the rates of infection are going to start going up. A bit more, and then we're going to lock down again. That's what's going to happen. So expect the second wave. For all of you who are out there, please continue to quarantine as much as you can. I understand The economic burden is huge. If you can stay home, please do so. Wash your hands, clean surfaces, and look out for people who are a little more at risk of catching the infection. I also had another question on here. People were talking about herd immunity and what's going to happen with that. So herd immunity it's kind of similar to giving what's going to happen with the vaccine. So say if we didn't have a vaccine, people who catch the infection will, to a certain degree, be immune to reinfection. But we really don't really know how long that's going to last for, if at all. It might be a few weeks, a few months. Sometimes with the flu, people get it again within the season, or at least the very next year. We don't know if that's going to happen with COVID-19. So the idea is if enough people get COVID-19, then the rest of everybody else will be immune to a certain degree, right? Because they won't be reinfected, so the whole country will be safe. We'll be able to go out, powwow, kick it. The problem with that is that people are going to die for sure. So in terms of herd immunity, in order for it to work, at least about 60 to 70% of the population has to contract COVID-19. So if the entire US population is about 380 million, right? That means even though 80% of those people will be fine, they'll just have mild symptoms and even no symptoms whatsoever, right? Around 10 to 15% of people will need to go to the hospital. And even more, now they're doing studies, about 1% of people will end up dying. So out of 380 million people, all right, 1%, about 3 million people will die, which is huge. That's a huge sacrifice. Not only that, but it will overwhelm the medical system, causing people to die of other causes. I can't tell you how many times in the hospital I didn't admit somebody because we didn't have enough beds. Even though, you probably need to come to the hospital, but my threshold for being sick had to be raised because you didn't have enough beds at all. So even though maybe at another time would admit you to the hospital, because of our situation, I can't right now. And that will be huge, 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 huge. We'll have to make, as a country, many sacrifices. So to wrap up, my people, I appreciate everyone coming to the Stoop. I appreciate Colonel Jamal Roche for sharing his presentation with us. It was really helpful. We'll continue with these episodes. This is episode 6. We'll do episode 7, same time, same place, Thursdays at 8 o'clock. I appreciate all of you being out there. Continue to donate if you can. We really appreciate it. On Saturday, I'll see you guys at 9 p.m. at DJ MOS, DJ Moss, on his Instagram Live. He'll be DJing, he'll be asking questions. Continue to be safe, continue to be healthy, continue to be aware, most of all. And please, please know, even though we are apart right now, we'll go much further together. That's our episode for tonight, and I'll take you guys later next week, actually on Saturday, and next week, Thursday, I will. All right? Take care. Peace.